Hello, my friends. My name is Christy Teigen. I'm a physical therapist. I specialize in women's health, issues of the pelvic floor, issues that come up during pregnancy. Today, I wanted to talk to you just a bit about posture and good stretching program that you can be following daily or at least several times a week just to prevent any pain or injury, and also just to make delivery as smooth and pain-free as it possibly can be. So let's start out talking about posture. We're going to start from the top of your head and work our way down. In our society today, we tend to be forward quite a bit, working on computers or even just looking at your phone. It puts you in this flexed posture, and that's something that's important to be throughout the day deliberately moving out of. A lot of people can develop neck and pain out even into their shoulders because they are in this forward flex posture. So let me teach you, how do you know if you are tending towards this forward position? Walls are straight. I'm going to turn you with me here so you can see me. The best way I have found to teach somebody what straight feels like is to back them up to a wall. Walls are straight. So right now my heels are just a little bit off of the wall, not far. The backs of my hips are touching the wall. The backs of my shoulder blades are touching the wall. And the back of my head is touching the wall. This is how I know I'm lined up straight. You might find that in order to get your head back, you're wanting to do this. So make sure your eyes are going straight ahead and you feel like the top of your head is parallel to the ceiling. That is when you know you're straight. And it might feel quite strange to you. So take a moment, settle in, get comfortable with straight. And when you feel like you have it, you can move away from the wall, knowing, this is how I'm supposed to feel if I'm straight. So throughout the day, because many times we are forced into this more flexed posture, take a moment, take a little computer break, and do what we call chin tucks. I'm going to show you from the side what a chin tuck looks like. So ultimately, we want your earlobe lined up right over the tip of your shoulder. So when you're working away, your head is often forward here. So take a little break and do a few chin tucks. And that is just pulling that chin straight back the same way it felt when you were against the wall. And hold it for about 5 seconds there. And then you can let go. And then bring it back and hold it again. Just strengthening those muscles that keep your head in the position that it should. When you're pregnant, over the period of your pregnancy, you're going to develop more breast tissue. And that means more weight in front, which also contributes to this pulling you forward. So really working on the position of your head, being aware of that, is very important. So that's step one. Let's work on getting our heads back lined up over our shoulders. Step two comes really at the shoulder. And the reason it can become an issue is just what I was talking about. That increased weight or breast tissue in front can cause us to sort of roll our shoulders forward. So you're going to want to take time. I would recommend once or twice a day. It doesn't take long. A stretch, which is what we're talking about now, should be held for at least a minute in order to allow muscles to lengthen. So you can certainly find a doorway. You're standing in the doorway, your hands are on the door frame, and you can play around with what level feels good to you for your hands. Mine are usually roughly about shoulder height. And then you just lean through the door, allowing yourself to feel a stretch right here in front. Again, a stretch is held for the count of 60 minimum to get lengthening here of this pectoral muscles. You can also do the same stretch. I'm going to put my back to you, but show you a corner of a room works well also. So here I do choose to put my hands shoulder height. I face my fingers into the corner that I'm stretching in. And then I just lean in. And again, feel that pull in the front of my shoulders. And I hold that stretch for a good 60 seconds. Now, of course, you also have weight. I'm turning the camera here because I'm going to show you a few things on my hands and knees here on my treatment table. You also have additional weight, quite obviously, in your belly. That is going to grow and grow in a wonderful way over time. So it's very important to kind of stay loose through your lower back here. And a really nice way to do that is on your hands and knees. Now you probably don't have a treatment table like I do at home, and you certainly don't need one. You can do this on the floor. You can also do it on your bed if that works better for you. But hands and knees, I want you to really just kind of notice my lower back here. And so what we're gonna do is just drop the belly down, looking forward, feeling a nice stretch through there. And now I want you to pull your low back up, up, up like you're arching like a cat, getting some nice movement through your pelvis. We really want to keep that nice flexibility that comes from just this cat-cow movement. Here's the cow looking straight ahead, nice sway back. And then we pull up into the cat. Try not to let your shoulders creep up by your ears. Keep them relaxed. And go through like 5 times of doing this. It really feels great. Then from here, I want you to move your knees nice and wide. Mine are gonna be as wide as my table, and my big toes are pointing towards each other. And here I'm just gonna sit back and get a nice stretch through my pelvis. This is very important. You're really gonna wanna be doing these hip openers, helping make more space in your pelvis. Certainly necessary as your baby descends and for childbirth. So if you don't get to this early on in pregnancy, make sure you're doing it late in pregnancy. It's a very nice hip opener to work on. Again, let's hang out here for at least a minute when you're stretching. Really just enjoy the time. You can relax your head, focus on some relaxation breathing. Just feel good about it. All right, now we're gonna walk our knees back in underneath our hips. And another spot where you tend to get quite tight is in the front of your thighs. So a nice way to do a stretch for this is going to be to just step a foot forward. You're gonna be on the floor, obviously, here. And then as you lean forward, you're gonna feel a stretch right here in the front of your hip. And just allow that gentle pull. This is gonna keep you from getting pulled too far forward from the weight of your belly. We wanna stretch this out. So you're gonna do a minute on each side. Make sure you're careful as you move. Pregnant bodies are prone to injury because your ligaments are relaxing in preparation for childbirth. So move nice and slow, and again, I'm stretching the hip on the other side that you can't really see right now. And you can, move your arms up overhead, give yourself a nice stretch through your shoulders here, whatever feels good. The last one I want to show you will be done in sitting. And you're just going to sit. I'm going to move this down a bit so you can see. You're going to sit with your feet together and then slide them in as it feels good. Everyone will be different. It's totally okay. It's not a competition. You want to sit not like so, but rather as straight as you can. And if you feel like you can handle more of a stretch, you can use your arms here and push your legs out, leaning forward. Just take it to where you're feeling a stretch. You don't want to be cranking on yourself or bouncing, to just be a gentle stretch that you can hold for a minute. So we started at the top, working on your neck, head position. We moved down to your chest, then we worked on some pelvic mobilization, and then the front of your hips, and lastly your inner thighs. Do these stretches daily or every other day, and you will be taking care to stretch all you need to get you through a healthy pregnancy. Thanks for watching. Good luck to you.